A Fox 61 exclusive this morning. Long before the pandemic hit, our country and our state was dealing with another killer, addiction.
Margaux Farrell joins us now with an up-close look at one man's story. Margaux.
Tim, Ashley, good morning. Good morning to everybody at home. It simply couldn't get much worse for a man named Pedro Robles. I have an exclusive look here at his constant struggle to stay clean and how the pandemic has made it almost impossible.
I've used marijuana, speed, hashish, cocaine, heroin, crack.
Pedro Robles started smoking marijuana as a teenager, and once he hit 20 years old, he was a full-blown addict.
It opened the door to other stuff, and the other stuff just took a hold of me, and it hasn't let me go yet. And now I'm 61 and still struggling.
Robles' addiction led to problems with family, friends, law enforcement, job loss, evictions, and then in 2020, it got worse.
I was weaning off. I went to a treatment. Things were getting better, and because of the pandemic, I shut down.
Robles was evicted because of his drug use, and after finding a new apartment, he and his girlfriend's drug abuse led to them losing custody of their daughter, who now lives with Robles' niece.
But it makes me feel terrible because I can't do much for her.
But Robles has been getting help through the Community Renewal Team in Hartford.
The door's always open, and they keep me afloat because they're constantly checking up on me and making sure everything's all right.
Yet Robles continues to use, knowing his next high could be his last.
Have you used today?
Yes, heroin.
Robles isn't alone. 2020 could end up being one of the deadliest years on record because of the pandemic.
I really don't want to say it. However, the government gave everybody $1,200, and that was a boost for a lot of people.
The AP reports in 2019, the U.S. saw a record high 71,000 overdose deaths. In Connecticut, preliminary overdose deaths also went up 19% through the end of July compared to the same time period last year. For Casey DeRozier, who works with addicts in CRT's intensive outpatient program and has known Robles for years, she fears it will only get worse.
The addiction's telling you to distance yourself from people. They don't care about you. And COVID's telling you to distance yourself from people.
That physical, in-person, sober connection is what DeRozier and so many other addiction experts say is crucial for recovery.
So what happens? They end up using and potentially overdosing and dying, and nobody finds them.
Being locked up in a house, limited to what you can do, there's a void.
Data shows that in every state that the AP researched, overdose deaths reached their highest numbers in April or May. The AP also cited ODMAP and found 62% of those counties say they saw increases once those lockdowns started. Robles says he is trying. He wants a better life for himself, his girlfriend, and his daughter. And when he hopefully reaches sobriety, he said there's so much he wants to do.
When I see that, I see myself going, go bowling if I can. I like go-kart riding, sliding down a hill with snow on a sled if I can. You know, that's what I see. Sitting in a restaurant and having a good dinner as opposed to sitting in the bathroom or in the kitchen table spending $40, $50 on garbage.
DeRozier believes with the right support and treatment, Robles has a chance to be that person he wants to be.
He never gave up. He came to every meeting. He made a way to get to the meeting. He would have to ride his bicycle across town.
But now, those meetings are virtual, which works for some, but not everyone. And for frontline workers, addiction is a health crisis on top of the pandemic. But hope is the key.
Every bad day that you have had, your survival rate is at 100%. So I always tell my clients, like, is your heart still beating? That means you have a purpose.
For Robles, he says he just wants relief.
We're not bad people. We just struggle with an infection or disease that is uncontrollable at times.
Our big thanks to Pedro there for opening up and sharing his story, and of course Casey, the counselor that you heard from. So that was with CRT. CRT does offer several different programs to those who suffer from substance abuse disorder. The one that Pedro was doing was the intensive outpatient program. There are different qualifications for different programs, but the constant here is that the addict does have to give a clean urine sample in order to receive medications that are supposed to help wean them off of the drugs. But Tim, Ashley, that's obviously a lot harder to do right now with so much being different.
So what does this program look like, and to what degree has it worked so far?
Well, the problem is that in-person connection is not really able to happen right now. And normally, Pedro would go through a detox program, and then he would be able to get a drug called Suboxone. Now, again, he would have to provide clean urine. So when you heard there him saying that he uses heroin, well, that, of course, would give him a negative test, and he would not be able to get the Suboxone. But normally, it's a process of going, meeting with the counselor, getting a medication that will help you wean off, and just kind of working through that system and going to those meetings, which Casey, the counselor, had told me that when you walk in, you can't walk in without somebody giving you a hug or handing you a cup of coffee. And that connection, combined with the constant support in person with other sober people, is what they believe really can help Pedro and so many others who suffer from addiction, sadly.
All right, Margaux, thank you so much for all of that. And we'll put all of that in